This is our disease presentation, completed by Alexis Nizzo, Isabel Pastier, Madeline Wood, Marie Uhas, Mila Grantham, Rachel Burton, and Taylor Zemer, also featuring Tom the horse. We chose to do our presentation on colic in horses. Colic is officially defined as abdominal pain and is sadly the leading medical cause of death in horses. There are many different types of colic. The most common form is spasmodic or gas colic. This is when there is an excessive buildup of liquid and gas which creates pressure. Impaction colic is when an indigestible material accumulates and obstructs the horse's colon. This makes it difficult or impossible for a horse to defecate properly. Displacement colic is when a section of the gastrointestinal tract moves into a location it does not belong, which makes it harder for a bolus to pass through. Torsions are twists in the gastrointestinal system that can lead to strangulation, which is either full or partial loss of blood supply. This is often the most lethal form of equine colic. Lastly, enteritis is when there is inflammation of the intestines.
Have you called the vet?
Yes. Yeah, I think she's here, actually. Thank goodness. Oh my gosh.
What seems to be the problem is?
Well, he was rolling in his stall and he wouldn't stop, and I had to get him up, and then he didn't have any poop in his stall, and his belly's not making any noises, and I'm really, really worried because he was biting his side.
All right.
Horses will usually begin to show signs of colic by generally acting uncomfortable. Mild signs would include not eating or drinking, pawing at the ground, and a lack of profuse gut sounds. More extreme signs of colic include laying down and rolling. All colics are considered to be emergencies, so if your horse begins to show any of these signs, the vet should be called immediately. Once the vet arrives, the colic exam will continue as follows. First, the vet will check the horse's vital signs, which include the temperature, pulse, and respiration rates. Any large deviations from normal ranges are usually indicators for health problems. The vet will then listen for gut sounds on both sides of the horse to try and get an indication of how much activity is occurring within the abdomen. Finally, a rectal examination will be performed. This will allow the vet to assess if there are any major abnormalities within the bowel.
Right. Well, let's take his TPR. Have you done that yet?
No.
All right. Thermometer. So it's a little high, but not too high. Just a touch. Here's the thermometer. I'll take his pulse now.
So scared. He's my favorite.
Okay, his pulse is a little high as well. Not too bad. His respiration seems a little elevated too. He's probably just stressed.
What should I do? Walk him?
We should keep him moving and maybe give him some Banamine.
Okay. We'll go walk. Come on, let's walk.
The pathophysiology of this disease depends on the type of colic presented. Impaction and spasmodic colics are generally caused by improper digestion. Impactions are usually found at the junction between the left ventral colon and the pelvic flexure. The left ventral colon is very large, but the diameter of the colon decreases as it comes toward the pelvic flexure. Here, the colon also must fold over on top of itself, making it a common location for impaction. Displacements, torsions, and strangulations are found in portions of the colon that are not directly attached to the body wall. Strangulations may also be caused by a blockage of the cranial mesenteric artery. Some sections of the large colon are attached to the body wall near this artery, forcing the blood supply to travel the entire length of the colon before it reaches the pelvic flexure. Enteritis is caused by infection and can affect any section of the gastrointestinal tract. The horse's digestive system leads from the esophagus to the stomach and then into the small intestine. The duodenum of the small intestine turns toward the midline at the base of the cecum. It is at this point within the small intestine that enteritis may cause it to be distended with gas or fluid. Most horse owners will recognize the common signs of colic and can initiate treatment while waiting for the vet to arrive. The owner can check the horse's vitals and keep the horse moving to help evacuate pressure buildup from gas and stimulate intestinal motility. Once the vet arrives and determines the horse is suffering from some form of colic, a nasogastric tube will be passed through the nose and down into the stomach. Electrolytes diluted in large amounts of water will be passed down into the stomach to cause overhydration. This helps increase the secretion of intestinal water, which can soften impactions in fecal matter. Banamine can also be administered as a pain-relieving medication, which will allow for the relaxation of the intestinal wall and minimize tightening spasms of the intestines to better allow gas and fluid to pass through. After these treatments have been administered, the horse should be placed into a stall with water and kept under close supervision until it is no longer showing signs of colic. Hay and feed can also be slowly introduced once the horse has shown improvement and interest in eating again. In extreme colic cases, surgery may be necessary to remove the affected section of the alimentary canal. The vet will be able to determine the type of colic and the treatment necessary to ensure full recovery of the animal.
I believe he's colicking.
How much Banamine are we gonna give him?
I think 12 milliliters should do. He's about 1,200 pounds, isn't he?
Yeah, he's fat.
Okay. So we give him 12 milliliters of Banamine IV and keep him moving. He should get things moving along in his gut soon enough. Milliliters of Banamine. Right. Now we'll keep him moving. If that doesn't work, we'll tube him.
So keep walking. Come on, let's go.
A little dehydrated still. It might be time to tube him.
Okay, whatever you have to do.
So we're gonna tube him with a liter of mineral oil and 50 liters of water. Swallow. There you go. It should go about 5 feet in. Oh look, we have reflux. I hear more gut sounds now. The mineral oil must have softened up his poop.
Yay.
He should poop soon.